Welcome to today's Public Policy Issue Forum on Broadband. We're really thrilled to have everyone today on this important issue. I want to not only welcome you, but ask that everyone can maybe put their microphones on mute. If you'd like to turn off your video so we can highlight the panel, that would be great. And then don't forget to open your chat window where you can use that function for questions, which will be moderated by our esteemed moderator today. Want to talk just a little bit about our public policy issue forums. This is our second issue forum of 2021. We'll be doing 6 throughout the year, and you see the dates for our upcoming forums on your screen. The public policy issue forums are meant to be a high-level overview with the goal of educating a broad audience so more people can understand the issue and advocate to our elected officials. They will be every other month on the third Tuesday of the month at noon, and the next one you'll see is in June. As with all of our events, many of our policy events, and particularly anything that's policy related, we like to offer up our civility pledge, and the partnership supports the Drake University Ray Center's Show Some Respect campaign. And with that, we always like to take a moment to remind everyone of the importance of civility in today's event, and advancing meaningful conversation we understand requires respect. And at the partnership, we urge all Iowans to be courteous as they express their opinions about issues. Together, we can have the tough conversations in a respectful way and find common ground solutions. Broadband. Broadband has been not only a strategic priority of the partnership in 2021 and previously, but we highlighted it as one of our top public policy issue priorities for the 2021 state legislative agenda. And it will certainly be high up on our list for our federal agenda as that is currently being wrapped up. I also want to mention that the partnership launched the Central Iowa Broadband Internet Survey for 11 counties in the region. The purpose of this survey is meant to measure broadband internet availability and identify areas that do not currently meet consumer needs and expectations. The survey will be open through April 27th, and we will be sure to post the links here in the chat function throughout today's session. And without further ado, I'd like to introduce today's moderator. Dave Price is an Edward R. Murrow Award and National Emmy Award winning political journalist. And this month, and on April 5th, he celebrated 20 years at WHO 13 in Des Moines, reporting from the First in the Nation caucus state. Dave has interviewed dozens of national and international political leaders, including President Barack Obama, President Donald Trump, British Prime Minister Tony Blair, and countless presidential candidates, members of Congress, governors, and local leaders. And I know I always enjoy watching his Sunday morning show. And with that, Dave, I'll let you kick us off and introduce the rest of our panel. Thank you.
Hi, everybody, and good afternoon. Seeing my picture there makes me yearn for my glasses, which my puppy ate a couple weeks ago. Which is why I'm terribly short-sighted right now until later this week. And I did buy local, which has always been a big part of the partnership's goals, right? So I did buy local in my new glasses for the rest of the week. So I may be squinting a little bit here today, particularly when I need to read. But good afternoon, everybody. Fun to be a part of this. How about we introduce the panel? Let's start with Laura. Laura Smith is the Chief Information Officer and Senior VP at UnityPoint Health. She is has held the role of Vice President, Chief Information Officer from 2016, responsible for a centralized information technology department across the entire system there. She should tell the story about why she's in the office where she is today, which is a fun story, but I don't want to get too personal there. She's passionate in creating an environment where team members can do their best work in providing business process enabling technology solutions to the customers she serves. And she's been recognized for a bunch of stuff here. So here's a short list. Becker's CIOs to know, Becker's Women CIOs to know, Health Data Management's Most Powerful Women in Healthcare IT, and CIO of the Year in 2018 by the Technology Association of Iowa. So welcome to you. The second guest on the panel, Annette Dunn, is the Director and CIO of the State of Iowa Chief of Information Officer, appointed by Governor Kim Reynolds back in August of 2019. Before this, Annette was with the Information Technology Transportation Division Director with the Iowa Department of Transportation back from 2015 to 19. And over that time, implemented numerous technology upgrades, including a new ERP system for the DOT. Also previously served as Director of Support Services and as the Winter Operations Administrator for the DOT, which is quite a job, where she was instrumental in the implementation in the statewide winter operation global positioning system advanced vehicle location project, more than 900 snow plows that have been replicated in several other state DOTs. If I may just say, one of the coolest thing about the system that we tap into during our storm coverage is those plow cams when they're out there plowing the roads, and we can take those live when we're on the air. So super cool. And we can get those. Plus you can follow those things all over wherever they are, the GPS. So anyway, so I'm sure you've done a ton of stuff since you've been in the job in your career, but that's like one of the coolest things because we use them all the time. So thanks for that.
Thank you.
All right, batting third today, Brian Waller, the president of Technology Association of Iowa, the statewide voice for Iowa's technology industry. Brian's a graduate of Colorado State, and prior to becoming president at TAI, he's held positions such as the executive director for the Des Moines Downtown Chamber, along with the manager of business development for the Iowa Economic Development Authority. So hello, everybody. Glad to be a part of this. All right, we've got a kind of a list of questions to follow through, but maybe just to get us going. And Laura, maybe we'll start with you. Maybe if you just want to do a few kind of opening remarks here, and then specifically maybe look ahead, is where do you see the challenges of broadband? There's so much focus on that for a million different reasons, especially over the last year as we've dealt with COVID, but where do you see the biggest challenges right now?
Yeah, absolutely. I would say access to healthcare and, I'll say internet capabilities has been necessary for healthcare for many years. But we knew that before the pandemic, absolutely, but it was acutely aware during the pandemic, and our operations were stretched to degrees that had never been experienced before. And having access to broadband and really being able to extend our reach to our patients and to our other entities that we serve in some of the more rural communities has been critical. I really don't see that changing in the future. And if anything, it's going to be even more necessary and will be even more critical to our operations. And so one of the greatest challenges, I think, is really our greatest opportunity, as it nearly always is. And it really has to do around this concept of health equity. And when I think of a lack of access to broadband, that creates a digital divide. And that digital divide absolutely contributes to health inequity. And so really the greatest opportunity here is, I think, if we are able to close or narrow that digital divide, we're able then to create some opportunities as it relates to health equity and really all of the zip codes within the state of Iowa.
All right, Annette, you want to go next? Where do you see the biggest challenges looking ahead?
Sure. So as a native Iowan, I'm really excited for our opportunities. And I agree with Laura that this really is an opportunity for us to proliferate universal broadband resources statewide. And as someone who lives in the rural area and also the outskirts of Des Moines and even particular areas of Des Moines, we really need to be targeting those areas that are less than or equal to 25 upload, 3 download, and increasing those speeds as we expect them to be for telehealth, teleeducation, and remote working. But our biggest challenge that we are going to face is resources. We all know that the legislative body and Governor Reynolds is really proposing significant amount of funding towards this, which is definitely needed. But the problem that we face is that broadband is part of infrastructure. We all know that the federal government is putting money towards infrastructure, which means time, equipment, individuals to help us with the equipment in the state of Iowa is really going to be restricted. So we have to make sure that we stay on top of that. It reminds me somewhat in the state of Iowa where electricity was around the 1900s, but we really didn't have a federal initiative on electricity in the rural parts of Iowa until about 1936. And so that's 36 years later, and there's no way that we can do that. We have to have these resources, the time, the money, and really make a huge effort towards proliferating this very quickly.
All right, Brian, what's the biggest challenge, do you think?
I see a couple, perhaps, Dave. One is obviously future-proofing the investment. Technology moves at such a rapid pace. How we keep up with it and maintain that investment for the long haul, I would think, is a challenge. But on the social side of this, as we get more Iowans that have access to high-speed internet, more access to the information and innovation economy, how are we upskilling these Iowans to utilize these systems that they've never really have been comfortable utilizing telemedicine or utilizing state government in a way where people that have more connectivity are literally buying homes online without looking at them? So how do Iowans, now that we give them access, how do we upskill them to the information economy and how to access some of these systems that some of us take for granted? So those seem two challenges on the funding front and on the social side, probably.
Laura, where do you see, looking down the road here, I've heard people talk about a lot of different opportunities, in particular with telehealth. Where do you see, like, can you maybe wow us with some kind of like cool factor about, oh man, that would be really cool if this happens? Like, what's a practical side of this that you can see maybe a couple years down the road that you'll be able to provide that can't happen right now, or maybe is on a limited basis now?
Yeah, one of really the most phenomenal programs that I see that we are just touching the surface on and participation is a hospital at home program. And we're one of 6 organizations in the nation that are using this program. Again, it's still somewhat in its infancy, but what we're able to do is allow patients to be in the comfort of their home, but have direct access to the provider through, a virtual visit, a telehealth visit. But in addition to that, also the whole host of connected medical devices that sends them home so they can be monitored safely for something that maybe in the past would have required them to be within a hospital. So again, one of 6 in the nation kind of piloting or using this technology and piloting this program. But I do see that will be more prevalent in the future. And again, all of those devices and those connections are relying on access to and connectivity. And that needs to be stable and available and at the right levels to support those technologies.
There are a lot of decision makers and thought leaders on this gathering here. So, Laura, though, I've heard from some providers, though, that looking forward, one of the challenges may be the reimbursement. So,
sure,
you may not get as much and cover the cost of the service having somebody connect from home as opposed to coming into the office. So how big of an issue could that be?
That absolutely could be an issue. And from a public policy perspective, we would certainly advocate for telehealth parity, which is the language that we use for that. So paying for those visits in the same way that people pay for care if they were to come in person. So we think that's really important. Again, for this hospital at home program, part of it includes how you get paid for a model like that. And so when we're testing that and piloting it, understanding the payment model and using that as a way to fund it in the future. So we definitely think that by testing these, we can prove that we can provide high quality, great care at a reasonable cost. And of course, would expect to be paid for that as well.
Annette, the governor wants to spend $450 million over the next 3 years. So roughly speaking, $150 a year. But legislators have been frustrated trying to figure out how to navigate this in some cases because you have a lot of these federal dollars coming in through the various relief packages that have come. And the challenge is how do you allocate this money and for what can it be used? And can it be used on a long-term thing or can it only be a short-term kind of COVID fixer kind of project or what? So you have the legislature hoping to adjourn here in the next several weeks. So how is that getting figured out behind the scenes?
You know, that is going to be a difficult one to navigate in the next 2 weeks because what we have seen typically, for example, with the CARES funding that happened last year, it takes about 60 to 90 days to actually get the rules. And then sometimes they refine the rules, as we have seen. They go forward, they say you can do this, and then sometimes they say, oh, but not that way. And so that continues to be a challenge. So our stance on this is for the state government to go ahead and allocate what they're going to allocate, hoping to get that out as soon as possible to Iowans, because it does go through a long process. We have to follow a lot of rules and map making to get these monies out, and we will have to do the same thing with the federal money. So our stance is to just keep them kind of separate until we have more information.
So just to put a finer point, you would say the preference would be for legislators to allocate current state resources and kind of forget about the federal aid money for now, and then can that slide in or what?
Yes, that is what we would do. And that's what we did with the CARES money last year. So last year, the legislative body allocated $5 million, and we went ahead and got that money out. And then by the time we figured out what we could do with the CARES money, we put another $50 million out immediately. And it actually went out in 2 iterations because the providers, the vendors, were just not prepared to make that many applications that fast. So we can actually deal with both situations as the money is decided, but it's best if we could just get moving on at least the state money and get that out.
Brian, you don't just view the Des Moines Metro, you have a statewide look at all of this. As we sit here right now, how much are businesses hindered by a lack of reliable, fast enough broadband where they can really use this for a variety of reasons to succeed?
Well, I think you'll see pockets around the state. I think we've had this conversation before. You'd be really surprised in rural areas to have very, very connected high-speed internet due to a lot of really great rural telcos around the state of Iowa. But I think now that you're seeing it's not just businesses impact. I think it's school districts, it's folks that want to interact with Laura Smith and UnityPoint and telemedicine. So I think that the gap is pretty large out there. And so when I talked about future-proofing the investment, I think anybody who has that answer is probably lying to you, because I think that's a really hard answer to come up with. And so if we look at it, we said, well, we need to invest in emerging technologies around the state of Iowa so those folks in rural parts get access. Think about a couple emerging technologies, precision agriculture. Well, precision agriculture around the state in those pockets that you talk about that might not have connectivity, to do precision ag, they need a high-speed internet and need some really great connectivity. You think about what Annette did at the DOT, some wonderful innovations she did at the Department of Transportation. Think about the future of autonomous vehicles all around the state of Iowa that are going to take all parts of the state of Iowa, including those that don't get connectivity. So when we talk about kind of staying ahead and investing, I would look to emerging technologies that depend on connectivity that I think will hopefully take those gaps and close those out with them around the state of Iowa.
So what specifically has to happen with the infrastructure to get to the ideal level here? I think Annette was talking about 25 up and 3 down, right? But that's pretty basic, right? I mean, isn't 100 where you kind of want to be where most people would want to be ideally?
100 up, 100 down, and Annette can correct me, but that's the word, that's the numbers I hear. I don't forget the number that you just quoted, but there are other parts of the state that have very little connectivity, not even that. And so I think I applaud the governor. I applaud what Annette's doing, is because they're trying to get out to pockets of the state of Iowa that have literally no high-speed internet connection. And so, yes, it's getting those levels up, but it's also even giving access to those that have very little high-speed internet access.
All right, Annette, I'm really going to put you on the spot here, but this is a friend brought up the other day when we were having this discussion. Let's say the legislature goes for this, you get your money, you really start going here. What happens when Elon Musk here in a couple of years gets this satellite thing going that means we don't need to be digging up the ground and all kinds of stuff and laying all this fiber and all this other stuff? Are we, and I don't know this stuff clearly well enough, but are we investing in a big way in something that could not be as efficient as another delivery service?
That's a great question. We try to stay vendor agnostic or technology agnostic. And I think whatever it takes to get the speeds we need and the services we need out to Iowans is the key. I have actually connected several of our very rural, no provider available areas to some things like SpaceX that you're referring to. And that it has helped the communities. Now, we are not in full mode for that to happen. They're only in beta testing at this point. It's at least another year off. And there are things that they need to improve at it from what I can see on the beta testing right now. But we do have conversations with them. To answer your question, I think it's very difficult to predict the future. Just like, when we were on dial-up, did we know we were going to have broadband needs? When we were on regular cellular, did we know that 5G was going to be here or if it was going to have any capabilities? I think we should always be pushing ourselves to have the best technology that Iowans deserve. And I think we always have to be looking at speeds. Some of the other things and the hindrance you have with satellite technology is there can't be any obstruction between the satellite dish and the sky. So you get into those issues as well if you get into a rural area with more trees or more valleys, those types of things. So I don't think we'll ever get away from having fiber, I think is what you're referring to. And there's a lot of people saying, why would we go in that direction and do fiber? Well, it's just because there's some people that don't have the access and they can't get adequate access without the fiber going to their house. And I think that's something we have to keep our eye on.
Laura, my doctor is in your system. And one of the things we've noticed through COVID as they've tried to reduce the number of people, waiting in an office and all that, that seems like would be a big benefit so far is that you can fill out all of your check-in stuff remotely. Yes. Which is kind of nice if you're, getting up there up to the last minute, especially if you're trying to get the kids in. Are there other ways that you've already used technology to either streamline or enhance the service and then maybe kind of take it forward where you see that going?
Yeah, absolutely. So yes, you got to experience some of that, right? With kind of filling your paperwork out ahead of time or checking in ahead of time. Something else that is across most of the organization then is a virtual waiting room, if you will. So it's text-based. And so prior to arriving at your appointment, you'll receive a text, you respond that you've arrived with then instructions on how to enter the building or where to enter the building. And the reason we did that, though, was to create a sort of virtual waiting room because we heard that our patients were more comfortable. They didn't want to sit in a waiting room, right? And so that was a way as a bit of an infection prevention strategy, but also, providing that for our patients. And so that's a really simple one to where we're trying to make that experience just a little bit better. If I were to look to the future, though, I would say you're starting to see some of this, but we'll see more of it. And it's transparency about your health information and you being in charge of your health information and who you share it with. So more recently, we've started releasing notes from your visit. So the provider notes, the clinician notes. So you're seeing a different level of transparency of those care interactions. And I think you'll see that increase. And again, in the future, you as a consumer have access to that information electronically or in any other format that you see fit. And so that I think is the future, is transparency around your health information so you can be in charge of your care and your data.
Brian, at the Technology Association, you already have a project going where you try to connect people who live out of state, but maybe have some kind of Iowa connection, family member, whatever it may be. What would the hindrance be right now to slow down or detour somebody from wanting to come here as far as our technology infrastructure is here? And I guess what I'm trying to get at is how you talked about we have pockets where it can be a challenge, and even in Des Moines, you may get some pockets where the speed is not what we want here. But how much of the state do you think is not being served well enough?
I would say a good portion of the state. And the project you mentioned is the Iowan project, where we came up with a map database, and we were actively recruiting Iowans who once lived here that no longer live here. We partnered with the Greater Des Moines Partnership, so shout out to the good people putting this on. But I think you'll find large pockets of the state of Iowa that don't have the connectivity that someone could move to Iowa with a job and expect to be in a Zoom meeting like this, working from the family farm and work for Google in Northern California. The level of connectivity it's going to take for someone to pick up and move their job to those pockets is you're going to need a high level of connectivity. And I think there's an opportunity right now in Iowa with people leaving dense metro areas and looking to the Midwest. And I think Iowa should be that place to do that. But to the whole point of our conversation, you're going to need high-speed internet to do that. And to bring your job, it's going to have to be exponentially quicker than it is right now.
I should have mentioned this. If you have a question you want us to talk about here, just send it through the chat. There's one for Annette here. What's being done to encourage broadband providers that are state grant recipients, those that are going to get the state funding here, to use in-state contractors for the infrastructure and construction? Is there anything built into the process for this?
There isn't anything in law for that, and we really don't ask about their subcontractors. Our role is trying to get that money out. And I think the quickest way possible to get service to Iowans, we don't object to it. I think it's a great thing to do, but I think at this point, with the entire nation trying to increase their broadband efforts, I think the Iowa companies will have just as much opportunity as any outside of Iowa company, because again, it goes back to my previous comment of resources. We don't have enough people, time, and equipment to really do all that needs to be done in the state.
And if I could jump in,
go ahead.
I would just say I totally agree with Annette. I think from the TAI's perspective, we would love Iowa companies to be the first go-to, but we're competing globally. And the technology world is huge. There are lots of service providers and vendors out there. So I totally agree with the state's perspective of we'd love to do it local here first, but we're in a global competitive world that we live in. It takes all providers.
Mm-hmm.
Annette, maybe give where does this legislation stand right now? What's the latest on this?
I believe that the broadband bill may be in an appropriation this afternoon. Actually, it could be going on right now. I'm not even for sure. Today or tomorrow, the House may come forward with its appropriation request. What I heard, I don't know if it's the latest because, it could be happening right now, is the legislative body was looking about 100 million, even though the governor had asked for 150. But the devil's always in the details. And sometimes, politics plays a role in the last minutes. So we'll wait to see.
But based on what you said before, though, even if that 100 ends up being the final agreement here, because of once you finally figure out what the final rules are for the federal money, though, there's nothing that would stop some of that coming in later, right?
That's correct. If we are allowed to do broadband, I would anticipate that the governor would allocate some for broadband if that was allowable. Again, we don't know the rules for that. She did that with the CARES money. She did $50 million last year during the CARES money, during the epidemic. At the beginning of it, we got that money out around June last year. And then we got the remainder of the money out after the first of the year because not all of it had been applied for. We have warned or gave the heads up to vendors in Iowa for broadband services that, hey, this money, either state or federal, is coming. You need to be watching. You need to be prepared. We need to update the map. So we're trying to anticipate everything that we can.
I know you don't want to jinx anything here, but is there anything that would make you doubt that this federal money can go toward broadband? I mean, that has been, it's our state, it's every state on so many different levels has talked about the challenge with this further exposed by COVID. How would this not be allowed?
I do believe it would be allowed. However, they also have money that is going to the FCC for broadband, which is at the federal level. So, and we have seen typically broadband be funded through FCC, and they have about 10 years to build out, which is extremely frustrating for the local communities. So we have seen that happen. So I never say never, and I kind of wait for the final details.
Brian, you talked about some communities have already found a way to do this, and some of them are pretty small providers that have ended up providing very impressive service in their communities. What is allowed? Because I've had some people say, well, if those communities figured it out, why do we need to figure this out on a statewide level here? Maybe let's just copy what's working so well in some of these places. That's
what's really unique about Iowa is all these rural telcos that are out there. And Annette mentioned, the electrification of Iowa. Well, these were the people that were doing that. And what you're finding is it's not worth the investment for them to go that extra mile into the fields, into the farmland. And so they figured it out. But again, if it doesn't make sense on the business side, they're not going to go that extra mile. And that's why you need some state funding, you need some federal funding to come in there and fill that gap for some providers that, it's not worth the money to put it in to get to just one farm out there. But we're knowing now is we need complete connectivity in every acre of this state. But I think it's going to take state funding and federal funding to get that last mile and that little nudge to get there.
Laura, hopefully this won't be a question that gets you in trouble or me in trouble for asking, but what do you think your system learned during COVID as far as technology goes? Because you all were you had such a unique situation where you can't just send everybody home and work from home, because that's not how a hospital works. And I know you figured out who could and who couldn't, but what did you all learn through this about, hey, we may need to upgrade our own infrastructure here or system?
Yeah, a couple things. We did send about 5,000 people home. So we did have that as a big body of work with a remote workforce. And there were certainly some learnings and a whole host of work associated with that. A little over a year ago, it's hard to believe. But as it relates to how we deliver care, there certainly was this kind of burning platform, if you will, to disrupt how we would traditionally deliver care. And I'll use just traditional telehealth as an example for our scheduled visits with an ambulatory provider or a virtual urgent care type visit. We had offered those previously, but the uptick wasn't quite there. We didn't have great adoption by our patients and maybe similarly on the provider side or the clinician side. But when that was one of the few options that you had, you figured it out. And actually, we saw over a 1,000% increase just in a couple months related to that type of care. And so what I take away from that is never let a good crisis go to waste, right? In that we learned something. We learned that we can disrupt our traditional business model, and it worked. And we were able to still provide really great care for our organization. And so you're not putting me on the hot seat, because I'll use this example, many, many times, in that what we were able to do in about 3 weeks, we should be able to replicate that for other types of technologies or services that we provide across the organization. And so you had asked or made mention of maybe this more consumer-friendly way to interact with your healthcare system. And we're looking to deploy here asynchronous visits, which is really a way to chat with your provider or with a care provider, and it's on your time and at your convenience, instead of maybe getting in the queue with a virtual urgent care, which is still pretty convenient. But if you can change that to a little bit more of a chat-based or asynchronous mechanism of receiving care, that's maybe even a little bit more consumer friendly. So those are some examples of things that we did, I think, really well, but they're challenging how we deliver care and show up differently for our patients and communities.
COVID aside, there were a lot of ways that having that instant access to the office helped, but I know just with our doctor, the simple ability to just get in that chat where you're essentially emailing back and forth, and you're not waiting on try to grab him when he's between
right
patients and me at work or my wife, whatever it is a huge change there. All right, Annette, since we didn't get Laura in trouble, let's see if we can get you in trouble. I'm going to try to use essentially the same question, and you're dealing with tens of thousands of people statewide here. So as COVID hit, which wasn't too far after you moved, right?
Correct.
Yeah. So
6 months.
Yeah. So you've got all these people and have to decide which ones can work from home, which ones can't. Is there an infrastructure that can facilitate this? How is that navigated?
Very carefully. I would call it organized chaos. We did a great job, though. Our team really pulled together. It was a lot of conversations with the governor's office, with agency directors. We had to very quickly spin up getting a lot of laptops for people who had just desktops, for example, as well as how do we serve our population and still work remotely. Interestingly enough, I had begun in my office doing an e-governmental portal, which we had just started the conversations about, but actually we were beginning to proliferate it and it's not even quite ready yet. We're going to be rolling it out. That would have been a huge benefit to us during the pandemic. And we will be perfecting that over the days, but getting the equipment, I had a little bit of a heads up that something was going on, as my son at that point, when the pandemic started, was at West Point and they were on spring break and they immediately called them back. I knew we were in for something, and I actually had staff go out getting laptops immediately. So in hindsight, that was probably one of the big pivot points for us. But then you get into the cybersecurity. You have all of these people working remotely. You don't know where they're getting the access. You don't know if it's secure, if they're on a hot spot in the middle of a parking lot that's open or not. So it became a cybersecurity issue for us. And it was something that gave us, you could either operate in the point of fear, or you can operate in the challenging moment and say, hey, we need to shift and this is what we're going to do. And that's what we did. I would say so. We have increased our cyber profile for state employees, but also for clients coming in through the system as well. So it was a quick spin up, a lot of communication with other directors and my staff. My staff did an amazing job trying to get everything out. For example, the other thing is when we were doing, I think it was when the National Guard was helping us do the assessments it was the contact tracing they were helping us with. We had to hurry up and find a bunch of iPads and really get them configured and out to the National Guard immediately. So it really took a team effort. You know, you have the National Guard that needs something, they're willing to step in. We had to make sure they had the public health information they needed, but they didn't have access to confidential information. And so it was just this navigating the whole process and coordinating it.
Brian, you don't have a staff of thousands of people, but you have technology in your name. So you can't fail on that, right? So if you have people working remotely, they need a strong signal. So how did you navigate this?
Just like everybody else, I think, just, with grace. And fun fact, last year as we were going through that, the chair of our board was Laura Smith. So actually great leadership. And I will highlight, if you think about accessing healthcare and accessing your state government, how important and essential these two industries were to Iowa. And we are so lucky to have information technology professionals like Annette and Laura to guide our state through these times, because I think you're seeing now information technology professionals all across the state are more important in their organization today than they were 14 months ago. You're seeing how Annette's talking about securing laptops for state government workers. Laura's talking about your personal notes from your hospital visit, and she has to secure that data. And so the information technology professionals, and that's who we represent here at TAI. And I am just so proud that we represent an industry of people that create technology solutions that really make lives better. And so I would just highlight these two individuals and the effect that they had on, state government and healthcare and the impacts on our life and the solutions that they've created, not only for us, but maintaining their team's morale and continuing to push on to get great technology solutions for our state.
All of you have to watch everything closely in your own little sphere, but then statewide as well. But Brian, let's start with you. What are you seeing done outside our state's border that has impressed you, that could either be something for us to think about or maybe use as a model as we move forward?
I would, again, go kind of lean back on investing in emerging technologies. And so we need to be creating more technology solutions here. And so let's not go outside the state to look for service providers. There's some really great service providers in cybersecurity But we've got to keep our eye on the future and emerging technologies. I mentioned precision agriculture. I mentioned autonomous vehicles. Artificial intelligence is not going anywhere. Cybersecurity is not going anywhere. Blockchain technology. And so for us to maintain our hold, I'm really impressed with states and municipalities that are on the cusp of emerging technologies. Not what was 10 years ago. You know, data centers were our thing for 10 years ago. Data centers were all being attracted here. Is that going to be our future? I'm not sure, but there's going to be another industry that we need to lead on. So nationally, we have a reputation as a technology state.
Laura, what have you seen in other systems, either in our state or outside our borders, that you think, oh, that's a good idea. That's something to think about.
Yeah. Well, when I think of this, Brian mentioned it earlier, we're in a global economy, right? And so when I think of that in particular, my competitors aren't my traditional competitors anymore. You know, it's not the hospital across the street, right? It's really anyone who can provide these services across the globe. And so I think the thing to learn about that is maybe don't view your competitors or the work that you do as the traditional competitors, don't look at them, look at other industry and what we can learn. And other industries, maybe comparing to healthcare, are more consumer friendly, right? They're easier to access. And so it's being willing to look at those other industries, other organizations, and disrupt how you operate. To kind of be future-proof, if you will.
Annette, do all the other states have a U?
I would say all of the other states have a state CAO, but not all state CIOs handle broadband. But we do, those of us that do, we do communicate, we do know what other states are doing, we keep tabs on them. And I would agree that Brian is absolutely right that you have to continue to look at innovation and technology and emerging technology. Two other things that I would add to the things that Laura and Brian said was affordability. So for example, what someone pays in the Des Moines area may not even be close to what they pay in the rural area. It could be twice as much for less connectivity. So it could be less than 25.3 or at 25.3 and $150 a month. So, you know, it really gets to affordability. If we're truly going to go to a global economy in Iowa, which we can and have done, if we continue to do that, we have to proliferate that broadband and get it the 100 over 100 by 2025, which is the goal of the governor. I absolutely agree with that. We have to have those high-speed connectivities. And the other thing that we need to be thinking about is, why could we not in the state of Iowa have remote working in a small rural community? A 50-mile radius in Des Moines is no different than a 50-mile radius in a rural area. So with a global economy in the rural areas, not to take away from Des Moines, but you can have that anywhere when you have remote working. And so it's going to be absolutely paramount for us to do that to be able to compete.
When COVID hit, now you mentioned that you may have gotten a little sneak peek of what was happening thanks to your son, but this was all really going down. Where did you turn to for guidance here? Did the different states kind of collaborate here behind the scenes about, holy cow, here's what we need to do? Because it's so, I realize you go through all these drills and you have all these scenarios about when stuff happens, but maybe you had one drawn up for this one already, but you know, since we haven't really had anything in like 100 years of anything to this magnitude,
right.
It's changed. So how did you know how to go forward?
It was more of an instinct. Yes, all the states do have connectivity with each other as far as information, but we were all going through chaos at the time. And so you have to figure out how to compartmentalize and organize that chaos. It was more instinctual. I have a military background, so the responding to an emerging situation is not uncommon for me. And so I would say from my perspective, it was just jumping into the fire pit, figuring out what needed to go where, what's the most priority. I was actually in the CEOC, the Emergency Operations Center, with the governor and the governor's staff and the other directors. And it's very it's a nice environment to be in. Not, you never want to be in there because that means you're in the middle of an emergency. But it is nice because I can look this way and talk to the DHS director. I can look this way and talk to the Department of Education director. What do they need? What do they need? Is there some synergy that we can have on some of these processes? And we did find that when you're all in the room collaborating, it does become a sense of synergy and prioritization just by default.
That's fascinating that you brought up that point, because some people, like, this to me is cool how, and we've started to use it in our news gathering about now we can hit people, whereas in the past maybe I had to jump in the car and drive an hour and a half to Carroll and figure out in my head, all right, that's a 3-hour round trip. I'm not sure there's really time to go do this, come back, get it all edited, written, and get on TV on time.
Right.
Technology's been incredible, but some people have talked to me about that they are concerned that we will look at this and think it's so efficient that we will then, once it's safe to get on the other side of COVID, we may not have those experiences like you did at SEOC, where you're sitting shoulder to shoulder with somebody and you can look up and kind of have that personal connection. Do you worry at all about that?
I do worry about it a little bit. As a people person myself, I do want to be around people. I think it's an individual choice. I think technology is going to exceed our expectations. And I think we're just moving into a different arena. I think it's important that we figure out how to communicate and be with our family and friends, and maybe our work relationships look a little bit different, or other connections. It doesn't mean that we're not going to have events, and concerts in the future. So I think our social events might look different and our work events might look different. But I do find efficiency. I get a lot more done in a given day doing this remotely than I do driving. Now, that doesn't help the DOT with gas tax, as I well know, working at the DOT and keeping our roads up. But, I think that's where our economy will shift as well.
Laura, we know you mentioned so many of the upsides for this potential of checking in with your health provider from afar. Would there be any downside that you would miss in a face-to-face conversation with your provider?
I think it absolutely could. Not saying it would, but it could. And I do think the relationship that a patient has with their provider can be very intimate. Right. And there just might be something that you're not able, or that you would feel more comfortable sharing in a face-to-face interaction. That's the reality. But the flip side of that is providers, I think, will be trained or have been trained on some of the softer skills associated with interacting via technologies as well. And so really paying attention to the nuances in the facial expressions, or just being really cognizant of who is this patient and do they need to be asked, how are you feeling today, right? And dig just a little bit deeper in that regard. So I do think that there can be a downside, but I also think that there can be ways to overcome or at least mitigate some of those challenges. And some of it, I think, translates though as well to the work environment. And so, we're on these Teams meetings a lot, or Zoom in today's case, and, just having some basic etiquette, like turn your cameras on, right? I know that's not appropriate for the participants today, but, just you can simulate. It's not exactly the same, but you can certainly simulate some of those interactions. And as a health system, we implemented incident command at the beginning of the pandemic as well. And we did it. There was a group of people that were physically together at one location, but it was also held via Teams, and it was very interactive, and we've gotten accustomed to operating in that way. So I only share that to say it's possible to have really great experiences through technology, but recognize what some of those limitations are and then figure out ways to overcome or mitigate them.
Brian, in the times I've talked with you, I've yet to ever stump you. So this is about the best I can ever hope for here, is that as you're the technology guy here, is there a downside to letting technology make our lives more remote, if you will, while it's a lot easier to connect, but we perhaps won't have as much face-to-face interaction? Could that be a bad thing?
You stumped me, Dave. I have no answer for that. So no, I like Annette am a people person. And so I really love being around people. I represent an industry of IT professionals. Now you have two very outgoing leaders here, but sometimes an information technology professional is not the one that wants to go out and do interviews like this. And so for some of them, I've seen people really shine. Maybe they're more vocal in settings like this. But my interesting thing is, will you become a CIO working from home? I don't think you will. If you want to advance and become a leader, you're going to have to be in the room. And when you talk about remote workers, I think an interesting point, we have staffing companies that are members of ours that are recruiting people for companies. They're seeing a big uptick from out-of-state technology companies going, hey, since people can work from anywhere, well, Oracle out in California is going to go pick off somebody in Des Moines because they know they have great work ethic. They know they have the great pedigree to do the job. They'll pay them a little more because it's those different wages. And so I think we need to be aware of that sort of dichotomy too that's going on. But the downside, I think, would be possible. People that want to be leaders, you need to have access to leadership. You need to be in the room with leaders, and you're not going to do that working from home. But I think I also think it's going to be you'll be able to recruit people that want to work from home. So as a company, you got to really be flexible with talent, because it's really a war up for talent out there.
All right, one question that came in here. There are a number of cities contracting with providers for service, especially here in the Des Moines metro. Is this a viable strategy for expanding access throughout the state to kind of do these partnerships like this? And is this the right way to go? Obviously, when you start doing this, and we're seeing, I think, West Des Moines, Ankeny, Clive, just a couple of them here where, this can brew a little bad blood too, because then the government's involved and you got different providers and all that. Maybe start with Annette, with you on this, but is that going to complicate things? Is that going to make things ugly as we try to move forward in getting better broadband for everybody?
It's a very competitive process in the broadband. The way that we have set it up is there's going to be more points, so to speak, for those areas that we know have less than 25 3 upload download. And so what we'll do is we'll focus on getting those who have nothing or very little or very bad broadband. And then we will fund, so it also depends on the people coming forward. And that really takes those community efforts, in my opinion. Otherwise, you leave this up to the vendors to decide where their biggest bang for their buck is. And I think back to Brian's point where he mentioned, it costs so much to get out to one farmhouse. That's why they don't do it. They don't make money on that. It costs maybe $10,000 to run the fiber out to a farm, and it's greatly needed out there. But it doesn't mean that it's any less important. And so I think that's where the communities have to come into play, or a cooperative, a rural cooperative comes into play and really ensures that these grant applications go to communities that need it. I can't give money towards somebody who doesn't apply to our process because it's a grant application process. And it doesn't have to be a vendor that applies to us. It can be a community that applies to our grant application process. And so I encourage communities to work with vendors that want to be in your area, that want to help you make those solutions. And we also have people you can talk to at our office about doing that. But you do have to, here's the other thing. Iowans like local control. We know that. We have 99 counties. We have hundreds of school districts, so forth and so on. We like our local control. And I think it's no different when you get into broadband and wanting to have your community have the best.
For Annette or Brian here, this will really put you on the spot, but just give a practical example, if you would, of the difference. If I'm sitting at home, especially like in my case, I have a couple of kids and they all want devices and everything. So we're all doing stuff at different times here. 25/3, we can do what? And 100/100, we can do what?
You want me to go? I will generalize this. It's very difficult to give you an example, but when we're doing this video chat, many times, Laura was bringing up, some people don't bring up their camera. Many times it could be because the more video feed they have going back and forth, it takes up more bandwidth. Then sometimes they don't have adequate bandwidth. Now, some people are just being lazy and they don't turn it on, or they don't like their picture up there, but sometimes they do shut off their camera when their connectivity is lower. So the video chatting back and forth takes a lot more of that upload download speeds, because you're uploading your video and you're downloading someone else's video, and you want it to be live and you don't want the audio to be off from the video. So the higher the speeds go, the more you're going to be able to do that. Now you take that to the next level and you say, if we're doing telehealth, telework, multiple people in the house doing this, you really have to have that 100 over 100 upload download speeds. 25.3 is barely going to maybe get you one upload download video chat that has a lot of interruptions. That's kind of there's somewhere in between, but there's also a big discrepancy between the two.
Or video streaming, right? If there are 4 of us in 4 different rooms, you're going to have a hard time to do 25.3.
Right. I would say that, and again, it varies. You're going to have a difficult time running the video streaming of Netflix or any of some of the younger community don't even buy a satellite service or whatever. They just buy the Hulu package or the Netflix package. They're streaming that. And then they're streaming their work and they're streaming their telehealth. And if they have kids, they're streaming their education on there. You cannot do that on 25.3, and you can't do it at all if you don't have broadband.
I'm going to squeeze in one right as we come up at the end here, but somebody asked here, are there any state initiatives focused on developing the future wireless broadband infrastructure workforce? So kind of training those workers for the future. Is there anything out there to help with that?
I can make one comment on that. In the Governor's Economic Recovery Board, that did come up, and it is one of the recommendations. I wouldn't say just for wireless. I would say we overall identified a lack of skilled workers to help us put in broadband, which is why I made the comment about resources. It takes the people. And that also is why I made the comment is that when someone asked if we would just use Iowa contractors, I would love that for our economy. I would love that for our people. But we don't necessarily have enough people to do everything we need to do to get 100 over 100 statewide by 2025. That really takes all hands on deck. And so training is an issue, resources is an issue as far as training them, getting them in the right areas. And I don't know, Brian, if you want to add to that at all.
Could not have said it any better.
Andrea, I know as a typical TV guy, I pushed deadline on you, so sorry I went over here, but
all good, Dave. This is such a great conversation. We really appreciate it. Everyone's time today. I'm going to try to reshare my screen just for a minute so that we can make sure we capture, as we always do at partnership events, some of our calls to action. And I might have lost my viewing of you, so pardon me, but really, first and foremost, we did talk a little bit about legislative efforts. There is the bill that creates kind of the policy framework has been sent to the governor. Please be sure to thank your state senator and state representative for their support of that broadband legislation. It was passed unanimously at House File 848. But then also, Annette brought up the funding. Reach out to your members and let them know that funding is key to ensuring that we have that robust investment in the infrastructure. And then lastly, I think Courtney will add in the link so that you can complete that Central Iowa Broadband Internet Survey, both for your residents and your business. And with that, I really, again, just want to thank you all for joining us today. We'll have our next forum on June 15th. And until then, have a great rest of your week. Thanks, everyone.